And today, March 9th, is World Kidney Day, and there are some things we can do to reduce the risk of chronic kidney disease. And for more, I'm joined by Titte Srinivas, and he is with the Intermountain Medical Center Transplant Program. Thank you so much for joining us.
Thank you, Surae.
So, you know, one thing that maybe a lot of people don't know is the connection between obesity and your kidneys. Explain that.
So, obesity is associated with a number of risk factors for kidney disease, such as high blood pressure and diabetes, which can cause problems with the kidney per se, because high blood pressure is a risk factor for putting a load on the kidneys as well as on the cardiovascular system. And the very things that make you obese and diabetic are the same things that can make your kidney disease worse. And so they're linked to each other both as associations, and also obesity and overweight can make one's kidneys much worse by putting a direct load on the kidney.
And so obesity, and then we also talk about diabetes, as you mentioned. So obviously we want to prevent any more damage to the kidneys. What are some of the prevention methods? So
the main things that, in a nutshell, the main things that prevent kidney disease are the same things that can keep you healthy. So a healthy diet that avoids too much of animal protein and fat and simple sugars, adequate amounts of exercise, and a prudent amount of salt. A balanced diet, exercise, good sleep, good lifestyle can prevent it. At the same time, one has to keep in mind that chronic kidney disease that follows uncontrolled obesity or high blood pressure or diabetes is not something that has symptoms up front. It's a silent disease. So unless a doctor takes the trouble of measuring protein in the urine or measuring a person's kidney function using a blood test, this may go for many years undetected, and people only know when they have symptoms, and at that time
when
it's too late, and then you're on the brink of dialysis or needing a kidney transplant.
And you know, I've talked to some patients who really don't heed the warning because we don't all realize how important your kidneys are until they start to malfunction. And I don't know if you've seen that, and some people who don't really heed these warnings of how important diet can be.
Well, we see that, unfortunately, a little too frequently, Surae. And that's exactly what we want to prevent. Very simple things. Get your blood pressure measured. Make sure that you know whether you're at risk for diabetes, especially if you have a family history. Make sure that you eat the right kinds of food and take the right kinds of exercise and avoid overweight and obesity.
So is just because you might be a little overweight, is that giving you more of a risk for kidney disease?
It certainly does, because people that are obese are 80 times more likely to get kidney disease than those that are not. But at the same time, it's not just obesity. Obesity is certainly preventable, but there's other things that can give you kidney disease per se, and obesity can contribute. And so there is a link in many ways between obesity and kidney disease.
And what are the top questions you might want to ask your doctor when you go into a regular checkup?
I'd like to know if I have protein in the urine. I'd like to know my blood pressure. I'd like to know what the level of kidney function is, which would require a blood test. Okay.
Thank you so much. Those are really good, really basic tips that everyone can do when they head into the doctor's office. More information at intermountainmedicalcenter.com, and of course more on our website at goodforutah.com.